So we are going to see about the tarsal joints. Okay, those are the joints which are present in the foot. Okay, so previously we have seen about the joint of the ankle. Okay, so which talks only about tibia, fibula, talus, calcaneum. Those roles and all will have a play in ankle joint. Okay, so these are the joints which will be present in the foot, only in the foot. Okay, so what are the major joints that are present in the foot? Okay, one is subtalar joint, the other one is talocalcaneonavicular joint, the next one is calcaneocuboid joint. Okay, so the name itself will imply you where the joints are present and what are the bones will play a role in this joint. Okay, so the first joint is subtalar joint. Sub means under the talus. Okay, under the talus. Okay, so the next is talocalcaneonavicular joint. Okay, so how many bones plays a role in this? Three bones. The one is talus, the next one is calcaneum, the next is navicular. These three bones will play a role in talocalcaneonavicular joint. The next is calcaneocuboid joint. Okay, how many bones play a role here? Two bones, calcaneocuboid bone. Okay, so let's see one by one. The one is subtalar joint. Subtalar, it is between the inferior surface of the body of the talus and the facet of the middle of upper surface of the calcaneum. So you should focus on this picture. Okay, so this is the talus and this is the calcaneum bone. So these two will be having a joint articulating surface. So subtalar joint. So the inferior surface of the talus and the upper portion of the calcaneum will be moving when the foot is moving. Okay, so that is subtalar joint. The next is talocalcaneonavicular joint. It is between the rounded head of the talus, okay, and the upper surface of the sustentaculum tali and the posterior concave surface of the navicular bone. So in this you have to see these three bones. Okay, the one is talus, next one is calcaneum, the next one is navicular. Okay, understood? So the talus and calcaneum will be articulating and the talus and navicular will be togetherly articulating and the navicular and calcaneum will be articulating. So that these three bones will be togetherly joined to form a talocalcaneonavicular joint. The rounded head of talus. This is the rounded head of talus. Can you see this shape? Rounded head. Okay. Have you all seen the talus bone? Yes. So the talus bone is one of the tarsal bone. It will be having a rounded edge. So that rounded edge will be having an articulation with the upper surface of sustentaculum talus. Here it will come and articulate. And the posterior concave surface of navicular bone. Can you see this navicular bone? In this, can you see a concave surface? Yes. So it will be articulating with the talus and these two will come and fit here to the calcaneum. Okay, understood? So that's why it is called as talocalcaneonavicular joint. The next is calcaneocuboid joint. Can you see? Here it is a calcaneum bone. This is a cuboid bone. So these two will play a role in calcaneocuboid joint. So what are the articulating surface? It is between the anterior end of the calcaneum and the posterior surface of the cuboid. Okay? Anterior end of the calcaneum and posterior surface of the cuboid. These two will be joined to present a joint called calcaneocuboid joint. Okay? So you came to know about these three joints. Okay? So why you need these three joints? Okay? What is the need? So the need is inversion and eversion movement in the foot. Okay. So when the foot is doing an inversion and eversion movement, these bones should move, or else you will be feeling a pain and a rigid like structure that is moving in inverted and everted motion. Okay. So to ease the movement and to reduce the friction and also to cause the movement in a smooth way, these joints are moving along when the ankle joint is moving. Okay. Have you studied about inversion and eversion in ankle joint? Yes. So those inversion and eversion not only takes place in ankle joint, also in the tarsal joints. Okay. So that is the role of tarsal joints. Okay. Understood, ma?